Let's take a look at comparing the 3 COVID-19 vaccines that are slowly becoming available to the American public. All 3 COVID-19 vaccines we will be discussing have been rigorously tested by the standards set by the FDA. Number 1. The Pfizer-BioNTech vaccine. This vaccine was authorized for emergency use by the FDA on December 11th. It works based off of messenger RNA, or mRNA. An mRNA vaccine does not use the live virus that causes COVID-19, and it doesn't affect or interact with our DNA. Instead, the COVID-19 mRNA vaccine gives instructions for cells to make a harmless piece of the spike protein, or one of the bumps on the outside of the virus. Once these instructions are delivered inside of our body, our cells use them up to make the protein piece. Once the protein is made, the instructions are destroyed. It's at that point that our body realizes that this protein is unfamiliar, and our body starts making antibodies. After this whole process, the body has learned how to protect itself against the virus with those specific proteins from the instructions. This vaccine is given in the upper arm muscle, and you need to get 2 doses, 3 weeks apart. A few side effects have been reported, like fatigue, headache, chills, and muscle pain, especially after the second dose. The CDC says that if you've had a severe allergic reaction to other vaccines, ask your doctor before receiving this specific vaccine. This vaccine has not been studied in pregnant women, but experts recommend if pregnant or nursing mothers want the vaccine, they should get one. Based on clinical trials, the Pfizer-BioNTech vaccine was 95% effective at preventing COVID-19. Since December 18th, there have been 50 million doses available to give to patients. It's expected that there will be 1.3 billion doses in 2021, and is recommended to those 16 years or older. Number 2, the Moderna vaccine. This vaccine was authorized for emergency use on December 18th. Just like the Pfizer vaccine, the Moderna vaccine works off of mRNA. Researchers have been working with mRNA vaccines for decades. What's appealing about these vaccines is that they can be developed with readily available laboratory materials. This allows the vaccine development process to go faster. This vaccine is given into the upper arm muscle as well, and you need 2 doses, 1 month or 28 days apart. The side effects that have been reported for this vaccine are fever, muscle aches, and headaches lasting a few days. Effects are reportedly worse after the second dose. Just like the Pfizer vaccine, the CDC says that if you've had a severe allergic reaction to other vaccines, ask your doctor before receiving this specific vaccine. There's limited data on pregnant women and nursing moms. The CDC says that pregnant women may choose to receive the vaccine. Based on clinical trials, the Moderna vaccine was 94.1% effective at preventing COVID-19. Since December 21st, there were 20 million doses available. It's expected that there will be 80 million doses for the U.S. in 2021, and it's recommended for those 18 years or older. Number 3, the Oxford-AstraZeneca vaccine. This vaccine is currently in stage 3 clinical trials, which means it's been administered to thousands of people in randomized controlled studies throughout various demographic groups. Unlike the Pfizer and Moderna vaccines, the Oxford-AstraZeneca vaccine uses double-stranded DNA instead of mRNA. What this vaccine is, it's a modified adenovirus, like something that would cause common cold or flu-like symptoms, with the added coronavirus spike protein. This virus can enter cells, but it can't replicate once inside of them. This vaccine is more rugged than the mRNA vaccines. The adenovirus protects the DNA inside of it. Therefore, this vaccine doesn't have to stay frozen. It can last at least 6 months while staying refrigerated at 38 to 46 degrees Fahrenheit. This vaccine requires 2 doses, given 4 weeks apart. As of right now, the first dose of the vaccine was 90% effective at preventing COVID-19 at clinical trial, but the second dose had around a 62% efficacy. Researchers believe that the first dose just did a better job at replicating the experience of an infection. The company expects to produce up to 2 billion doses in 2021, but it will not be used in the US until the FDA authorizes it. This is what we know about the 3 major vaccines so far. For more information about each one, visit the CDC website. Reporting and drawing for Cronkite News, I'm Serena Raboyne.